Hello, I am Molly Riley and I'm doing my presentation over muscular dystrophy. I have uploaded a attached PowerPoint so that you guys can follow along at home. To start off with, I want to inform you guys what is muscular dystrophy. It is a progressive degeneration in the skeletal muscle that is related to the X-linked disorder that weakens muscle. It is a heterogeneous group that is generally inherited disorder. Not all cases are inherited, but the majority of them are. And it is affects mainly young males, and with most cases there are cases of females with it, but they're very few, and there are other cases that don't start until people are in their older years, but it's mainly a predominantly juvenile disorder. One thing I found very interesting was how the muscular dystrophy only affects the muscle but not the nerve in the skeleton muscle system. The causes of muscular dystrophy are genetic most of the time. It's a defective gene. And it causes a lack of protein called dystrophin, and without dystrophin the muscle begins to weaken. A healthy person who has normal amounts of dystrophin is able to keep their muscles in shape and strength, and without it there's just no possibility of a person having strength or shape within their muscles. So the muscle begins to break down, and the mutation of this gene, like I mentioned earlier, are inherited, but there are some sporadic that people who causes, or sporadic cases that someone would just be born with it. There are many different types of muscular dystrophy. It's not just muscular dystrophy. There are over 30 types. There's a couple main few ones I'll get into in a bit, but each type of muscular dystrophy that a person may have weakens the muscles in different ways, and so there's many different variations of what kind of accommodations that would be needed, and some start affecting people as soon as infancy, while others don't affect people until they're in their late teens or early adulthood. The major forms of muscular dystrophy, and I'm going to read these and bear with me as I butcher their names, some of them are hard to pronounce, but the most common is Duchenne muscular dystrophy, and then there's Becker muscular dystrophy, and Emery-Dreifuss muscular dystrophy, Limb-Girdle muscular dystrophy, and Fascicular-Humeral muscular dystrophy, and Myotonic muscular dystrophy, and congenital muscular dystrophy. So like I said, those are just like the brief main ones that affect people. There are many more out there, but these are the most common, and I would say Duchenne, through my research, I found was the most common. Symptoms of someone who may have muscular dystrophy, and like I mentioned, since there's so many different varieties of the disorder, it might depend on which muscular dystrophy you are diagnosed with. They all do affect the muscle, and as the common symptoms that would stand out to anyone would be you notice that the muscles are weak, and they're slowly getting worse. There's a delay in motor skill development, and you can see that in difficulty walking, difficulty getting up from a sitting position, stumbling, and troubles with stairs. There's a decrease in muscle size. A person may drool a lot, and difficulty controlling your muscles, so not knowing how to work them. And you can see these things through the early signs, such as stumbling, waddling, walking up the stairs. A lot of times a child would walk on their toes so that the heels of their ground aren't on the their heels aren't touching the ground. They have trouble sitting and getting up from that sitting position. They stick out their stomach a lot, and they have troubles pulling their shoulders back. So they kind of have like a very hunched and arched look to them. They also will have difficulties raising their arms, and they will seem weak and tired. So a lot of these are very vague, so it's hard to catch, because if someone's weak or tired or struggling with stairs and stumbling and walking, you wouldn't just want to automatically assume muscular dystrophy. But if you start to see like their troubles when it really does come into the muscle, that's when you'll start to be aware that that it is an issue within their muscle. A lot of times kids will have really enlarged calves, so people think that they're fine because it looks like they have a big muscle in their calves, but this is actually scar tissue from their muscle, and it's actually not a lot of muscle. It's more scar tissue and can be open to infection. So the health effects that come or that will happen when a child does have muscular dystrophy, most children are wheelchair bound by the time that they are 10 or 12. So if they weren't wheelchair bound as a younger child, as they get into their early teens, they will most likely be, because they won't be able to work their muscles. There's a lot of cardiovascular complications as well as respiratory system complications. Scoliosis is another problem found in most cases with children with muscular dystrophy. They fracture and break their bones easily, difficulty with speech, and then they also have a little bit of intelligent disability, which only occurs in about 30% of kids who have muscular dystrophy. Cancer is more likely, it is more likely to happen in a child who is diagnosed with muscular dystrophy, and they don't really have a very long life expectancy. It's into their late teens and early 20s, mainly to do because they do have respiratory and heart complications and issues. And so, you know, people think about muscles and how they are your leg muscles and your arm muscles, but you don't think about the muscles that are your heart and your lungs and your tongue. That's why they have issues with speech. So, you know, 1/3 of this patients with muscular dystrophy do end up having breathing disorders, and they need a ventilator to help them with their breathing. And it's kind of a process of how far along they are with, or how healthy they are with their muscular dystrophy. So at first there's 4 stages with the ventilator, and the first is to help breathing with just very, very not very regular during the night, just when absolutely needed. And so like that's during the hippocampia sleep stage. The second is during the rapid eye movement. They will use the breathing machine to help the child sleep. Then the third stage, they are going to use it during the non-REM, which is the rapid eye movement, and the REM sleep. So that's becoming more progressive, more for almost a full night's sleep, that they're using the ventilator to help breathe. And then the last stage is where they need it all through the night. And by the time you get to the fourth stage, you have a good idea that you're looking at 12 months of life expectancy from that point. Doesn't mean that it's going to take that they're going to die within that 12 months, but that's kind of where they're sitting. A lot of the issues happen with the heart, because it is a muscle, and the main issue that they find with it is the cardiac fibrosis, and that's when it interrupts the heartbeat and the rhythm of the heartbeat, and you need that heartbeat and that pulse to be pumping blood to the rest of your body. And if you're not having that blood being pumped through your body, then your body and your organs start to shut down. So that could be another cause of death that is brought on by muscular dystrophy. One way that they do use to help slow this process down is have them use a pacemaker so that they can regulate the heartbeat and the rhythm of the heart. So in order to be diagnosed, I gave like the warning signs and like kind of heads up tips, but the only ways you can really know if a child is diagnosed with muscular dystrophy is through DNA blood test, which checks the enzymes and the genes that they have. They can do a muscle biopsy to check the muscle tissue itself, an electrogram or an EMG, and then there's other clinical exam findings and testings that they do in the hospital. So once you are diagnosed with muscular dystrophy, there is the treatments that they can help to make accommodations and life easier when having the disorder. Unfortunately, there is no cure, but there is hope, and a lot of that hope you can see is through the treatment. And the biggest things that they encourage for treatment is to keep your strength through exercise. So they want you to keep moving, or the child to keep moving their muscles so that their muscles don't become stiff, because they want them to be active and be able to use them as much as they can and not just have them degenerate. There's a lot of stretching exercises that are recommended, using stretchy bands to help with the muscle strength and hip flexors. They also do surgery, and the reason they do surgery is most of the times to correct the scoliosis. And there's mobility aids. Like I mentioned, most of the children are wheelchair bound. But there's leg braces that they can do, and they start with the leg braces when they're sleeping, and they progressively move to having them all the time. And the breathing assistance that I mentioned earlier, respiratory aids such as an inhaler or ventilator, and there are some medications that are out there to help slow the process down, but they don't stop the process, and many physical therapies. So the therapies that a child could be involved with through muscular dystrophy, as I mentioned earlier, physical therapy, doing those exercises and stretches. There's respiratory therapy to help with the breathing, speech therapy to help if they are struggling verbally, occupational therapy, and then corrective surgery therapy, and like I mentioned, the drug therapy of medications to help slow down the process. Having a child with muscular dystrophy can be really tough on a family, physically, emotionally, and financially, and so there are support groups that are out there. A lot of healthcare professionals offer support. You have family groups, support groups, and friends, community organizations, and you can find some in the place of worship. So even though I mentioned there is not a cure, there's a lot of research out there that is, and scientists working, searching, hoping to find one. Since there are so many different types of muscular dystrophy, it's hard to keep up with finding a cure for just one, since it's so broad in how it and how many that there diagnoses there are. So the research is struggling to keep up with the amount of diagnoses there are out there. I read about one study that they're doing in Japan. They've done it on mice, and it is shown to prevent muscular dystrophy, and they're hesitant to adopt it towards children because it's a very invasive procedure that happens during utero, so we don't know how that's going to affect a child or what complications can come from that. So right now they're just sticking to the therapies and the medications that they can use, such as prednisone, to help slow the process down so that they don't so that they can have a longer life, since life expectancy isn't that long. So I have a works cited of all of the journals and articles that I read to help me gather this information, and if you